While many people with mental health problems end up behind bars.
Tonight in News Channel 18 series Cracks in the System, Nicole Kahn takes an exclusive look at what is being done at the Tippecanoe County Jail to help those who face mental illness. Nicole, what did you discover?
Gina, recently the Tippecanoe County Jail began taking steps to get inmates mental health help, but it may not be enough to meet the need. Catherine Lawhorn's uniform doesn't look like the rest of the jail staff's. She's not a corrections officer, but a mental health clinician who works in the jail. She counsels inmates part-time.
There's so much more that I feel like I could do and that I want to do that I can't do with 15 hours.
Sheriff Tracy Brown says Lawhorn's position began when the jail received a grant from the federal government.
A significant number of those inmates have a history of mental illness and or an addictions problem, or are dealing with a coexisting diagnosis.
Many of the corrections officers also have crisis intervention training, or CIT, to understand how to better handle inmates with mental illness. They say the training is essential because they spend the most time with inmates.
Once they're in here, we're dealing with them daily.
But even with the added mental health position, there are cracks in the system. Lawhorn deals mostly with inmates who have mild problems like anxiety or depression. Those with more severe mental illness also receive help, but the jail can't accommodate all their needs.
We do the best we can to manage it, and if the inmate appears to be stable, then we just keep an eye on it.
An inmate is sent to an emergency care facility if they experience a mental health crisis behind bars. Then they often return to a cell. Sheriff Brown says he's working to expand the mental health clinician position, but a tight budget is an obstacle.
It's important enough to us that we are going to be looking for ways, creative ways to extend her stay here and provide more hours for our inmate population.
Sheriff Brown says he hopes to better connect inmates with mental health resources in jail so they don't return.
There's a very high likelihood that they're going to return at some point in time in that 3-year period of time after release.
He believes better mental health services behind bars will help keep the revolving door to jail closed. The grant for the Tippecanoe County Jail's mental health clinician position only lasts for 2.5 years. More funding will need to be found by mid-2012 to keep it. Nicole Kahn, News Channel 18.